Hi, my name is Christina Green and I'm a dietetics student at the University of Dayton. Today I'm going to be performing a nutrition-focused physical exam. This is an important part of the nutrition assessment and dietitians use it to better inform them on the patient's nutritional status. So we're going to look for muscle loss, subcutaneous fat loss, micronutrient deficiencies, and fluid retention. Is it okay if we get started?
Sure.
Okay. So to begin with, we're going to look at the hair and the scalp for micronutrient deficiencies. We're starting at the crown of the head. We're going to lift small sections of hair. Normal findings are strong, shiny hair with even distribution. Abnormal findings would be alopecia or patchy hair loss, banding, depigmentation of color, which is flag sign, and also abnormal hair loss, which is easily plucked with no pain. So looking at the scalp, we are looking for things like seborrheic dermatitis, which is a scaly, waxy plaque buildup, as well as looking along the nape of the neck for bumps, which are called follicular hyperkeratosis. Okay, so next we're going to move on to the face region, if that's okay. So we're going to start by looking at the temporalis muscles. Here we're evaluating for muscle loss. So if you could make a chewing motion. And while the muscle is engaged, we're going to palpate. Normal findings, we should be able to see and feel that muscle with strong muscle tone and resistance. Abnormal findings would be a hollowed out depression and little to no muscle tone or resistance. So next we're going to do around your eyes. Okay, so here we're going to check the suborbital fat pads. This is evaluating for subcutaneous fat loss. We're going to gently palpate the suborbital region, looking for a nice rounded shape with ample bounce back. Abnormal findings would be a little to deep depression, dark circles, and loose skin. Next, we're going to check the eyes for micronutrient deficiencies. We're going to gently pull down the bottom eyelids with our thumbs. Here we're checking for color. Normal should be pink and moist. Abnormal findings would be pale in color, as well as the rest of the eye. We're looking for things like Botox spots, which are frothy and gray spots in the conjunctiva, as well as xanthelasma, which are yellowish deposits around the eyelids. Also, while we're evaluating the face, we want to look at color. Is there any pallor? And we're also feeling the temperature to see if it's cool to slightly warm, which is a normal finding. So now we're going to look at the extraoral region. Once again, looking at color. Have they lost color? Are they dry or cracked, which could indicate dehydration? We also want to look at the corners of the mouth to look for angular chelosis, which is cracked, red, and swollen in the corners. Now we're going to move on to the intraoral region. Here we're looking for micronutrient deficiencies as well. If you could open your mouth for me. We're checking the overall color of the gums, and also looking at the condition of the teeth. Are there any broken or missing teeth? And we want to ask the patient if that gave them any difficulty eating. We also want to look at the color of the tongue. Is it swollen and smooth, which would be glossitis, or is there a beefy red tongue? Also, we're looking at the buccal region, looking for moisture there, because if it's dry, that's a good indicator of dehydration. So now we're going to move on to the clavicle region. All right. So here we're looking for muscle loss. We're going to palpate superior to the clavicle, checking the trapezius muscle, and inferior to the clavicle, we're checking the pectoralis major muscle. Normal findings are good muscle tone and resistance, and the clavicle is not prominent. Abnormal findings would be little to no muscle resistance, and the clavicle would be prominent. So next we're going to do the shoulders.
Okay.
All right. So here we're looking for muscle loss as well. We're going to check the acromion process to make sure that it's not prominent, and also we're going to palpate the deltoid muscle and checking for good muscle tone and resistance. Abnormal findings would be a very prominent acromion process and little to no muscle resistance in the deltoids. Okay, now we're going to do the upper arm region. All right, so if you could hold your arm out in front of you and then bend it up at a 90-degree angle. All right, here we're checking for subcutaneous fat loss. We're going to lightly pinch the skin in between our thumb and forefinger underneath the tricep. Put that down. Normal findings would be ample fat in between the fingers. We're going to check this other side as well. Abnormal findings would be little to no fat in between the fingers, and your fingers would be very close together. Okay. As you move down the arm, we want to look at the skin again, looking for color and texture. Are there any lesions or sores? Now we're going to check your hands. Okay. So first we're going to check for dehydration. We're going to lightly pinch the skin on the dorsal part of the hand. A quick rebound is a normal finding, and a slow rebound could indicate dehydration. We want to check both hands. Okay. Now we're going to look at the nails for micronutrient deficiencies. Normal findings would be shiny and mostly smooth with good capillary refill when lightly pressed. Okay. Abnormal findings could be colonekia, which is a spoon-shaped thin nail, looking for deep vertical ridges, or Bowes lines, which are transverse lines across the nail. Okay. Now we're going to look at your mid-axillary region.
Okay.
If you could put your arms straight out in front of you. Okay, here we're looking for subcutaneous fat loss. We're going to go down the mid-axillary line, lightly pinching to check for fat in between our fingers. And also we want to see if the iliac crest is prominent. Abnormal findings would be little to no fat in the pinch. And we would be able to feel the ribs and deep depressions in between, and also the iliac crest would be prominent. Thank you. Next, we're going to move on to the thigh region, if that's okay.
Yeah.
So we're going to check the anterior thighs and the patella for muscle loss. So normal findings are going to be a nice rounded shape on the inner and outer thigh. And abnormal findings would be slight to a deep depression on the inner or outer thigh, and the patella would be prominent and could take on a square shape. Okay, now we're going to evaluate your calf muscle. Okay. Here we're looking for muscle loss again. We're going to check the gastrocnemius muscle. Thank you. And make sure that it has a nice developed bulb shape and good muscle tone and resistance. Abnormal findings would be little to no bulb shape with little muscle resistance. Now we're going to check your ankles, if that's okay. We're going to check for edema in the lower extremities. Here we check for pitting. A pit that lasts for 0 to 30 seconds is mild fluid retention. And a pit that lasts for 30 to more than 60 seconds is going to be severe fluid retention. And this concludes our nutrition-focused physical exam. Thank you.